Hello, my name is Catherine Rutland. I'm Clinical Director at Denplan, part of Simply Health. I just wanted to update you a little further following my podcast earlier in the week of what's going on, what's happening, what we're picking up. It has been a very, very hard week for us all. I think it felt bad enough when I did the last podcast. I think that has continued. We have gained some clarity in some areas, and then the clarity has then sort of been muddled with other areas, causing a huge amount of frustration. I wanted to start there with a little bit of positive news because I think we need some at the moment. It's been really, really refreshing. I've spoken to quite a few practices who have used communication tools to their patients in so many different ways, either writing letters, recording messages on Facebook, lots of different things I've seen. And with the practices that I've spoken to, they've then said that the feedback from the patients has been brilliant, that they are supportive, that they understand, and if you're reassuring them that you're going to be there for them when we come out the other side of this, that's landing as a really positive message. So really nice to hear that positivity. I know we are still waiting for clarity in some areas, especially around furloughing and contracts and how that will work together, whether they can be done together. It is frustrating, and please don't act without taking really good sound advice from your accountant or if you're BDA member going to the BDA, in making sure that you don't make a snap decision on this because the clarity isn't there yet. So we are constantly watching and waiting to see outcomes. As many of you know, the BDA have put a lot of questions in, and hopefully some of those answers will be forthcoming. If not today, then hopefully the beginning of next week. So please don't make any snap decisions and make sure that you are taking really good advice before you do any of that. Whilst there's a lot of positivity in some areas, there are a lot of frustrations in other areas. And I'm hearing a lot of that, frustrations, confusion, not knowing what to do. We are trying to look at how we can support specifically in that area, just very much in a very mentoring kind of way to see how we can support you as the anxiety and so on carries on. Please bear with me on that. Hopefully we'll have some further news on what we can do with that early next week. On the kind of topic of frustrations, please can I ask that you respect our teams. I realise these are difficult times, but I've sadly heard some really upsetting stories of how some of our teams have been spoken to and communicated with, and they are all facing their own challenges too, as we all are in this situation. So please do be kind to them, and please just respect what they are trying to do for you. On that note as well, what I would say is please also make sure that those staff that you have furloughed already, that you're keeping in touch with them. This is a very difficult world, as we know. They are at home. We are social creatures. I know what it's like to be working in a small practice. There is usually a very good relationship between people. You keep each other going. You usually support each other through difficult times. That has now, for some of them, just been taken away completely at a very, very difficult times in our lives. So really important. I've seen it with my own team, who are now obviously all home working, and how that challenging that is for mental health, and really important that we support them. So please can I ask, don't forget that they're there. Make sure you check in with them. Have a team Zoom, whatever it is that you do, find a way and keep looking after them and watching out for them. So yeah, we've been trying to take your feedback and react as fast as we can. As you know, letter templates for patients have gone out. We sent out an email a couple of days ago with a series of FAQs of things that had come into us. We have been updating the blogs as fast as we can, and that can be challenging sometimes with the advice changing constantly, but we really are working on that as hard as we can. So please make sure you're checking the website, checking behind your portal for access to the more detailed information. and we will continue to work and keep those doing. I really hope you do manage to have some kind of more sane and more relaxing weekend this weekend. I think the sunshine has really helped this week. And look after yourselves, be kind to yourselves and be kind to those around you. It's the only way we're going to get through this. Hopefully speak to you soon. Bye.